Just like hospitals across America, Enloe Medical Center is experiencing a surge in COVID-19 cases. What does that mean exactly? That is exactly what we'll discuss today. I'm Suzie Lawry-Hall, and today I'm speaking with Enloe's Chief Medical Officer, Dr. Marcia Nelson. She's here to go over the current situation, how Enloe is responding, and how you can help, and more. Let's get started. So thanks again, Dr. Nelson, for being here. So when we say there is a surge, what does that mean here at Enloe?
That means our numbers of COVID admissions is going up. We've had 3 surges here at Enloe Medical Center. The first was a year ago, right after the July 4th holiday. Then after the Thanksgiving holiday through the Christmas holidays, we had another surge. And now, starting in July, we've had another surge. That means we have more admissions, more people on ventilators than we've had over the several months prior.
So now let's look at what happens if a patient comes into one of our clinics. So for example, prompt care with concerns of COVID-19. What does that look like for the patient?
So the patient comes in and gets identified as having some sort of respiratory concerns, or if they're concerned about COVID. We keep them separate from other patients who may not have those kind of complaints because we know how contagious COVID is. And then we streamline everything to do a test if appropriate. We have antigen tests for people who are sick. Those are the quick 15-minute tests, but if somebody needs to have the PCR, the tests that take longer, then we can do that also. However, we're not a testing site. We're not a place for people who are just concerned to come in and get tested. We don't have the resources for that. We don't have the staff to do that. But if somebody's really sick, then we will test them. If they turn out that they have COVID on any of these tests, then we'll determine how sick they are, if they have enough oxygen in their system, if they have other symptoms that may be related to COVID. If they are healthy enough to go home, then sometimes we'll give them a little oxygen meter so that they can keep track of how well they're doing at home in case the oxygen starts to fall, because that's the kind of crazy thing about COVID is people can get sick and it sneaks up on them. All of a sudden their oxygen levels are very, very low and they're very, very sick. So if they go home, they'll monitor their symptoms and most of the time do well. But if somebody's sick enough to have to be hospitalized, that will be identified by either their blood tests, their x-rays, or their oxygen levels. And if they have to be hospitalized, then we'll find room for them.
What would you say is the average length of stay for someone who is admitted for COVID-19?
It depends. It depends on how sick you are, and it also depends on if you're vaccinated, because if you are unvaccinated, your length of stay will be about a half to a full day longer than somebody who is vaccinated. So people who are unvaccinated are sicker when they come into the hospital, and anybody with COVID who's admitted stays about a half day or a day longer than people who are in the hospital for other reasons. So it's about 5 days, 5.5 days for a length of stay for somebody who's vaccinated, and up to about 6 days for somebody who is unvaccinated.
How do we determine vaccination status? What does it mean to be fully vaccinated?
A person's considered fully vaccinated if they are 2 weeks after the final dose of their vaccine. So that would mean 2 weeks after the single dose of J&J vaccine or 2 weeks after the second dose of Moderna or Pfizer. We verify vaccine status all sorts of different ways. It's easiest if it's on the electronic system that the state provides, but we also look at people's vaccine cards that they're provided. Most of the time we can do enough digging that we can verify that somebody's vaccinated.
So for people who are following us on social media, they know that we are now posting our daily COVID-19 numbers. Can you help us break down how we come up with those numbers?
We get the numbers of patients with COVID by looking at the results of the tests. Who is tested positive for COVID? The vast majority of these are people who came in sick from COVID. Occasionally we will have some patients who come in, and because of the screening we do of all patients who are admitted, we'll pick up some people who didn't have symptoms that were typical for COVID. But it really doesn't matter how we find them, because they all require the same sort of attention and the same sort of isolation. Really, no matter how you ended up with a COVID diagnosis. I was thinking about it this morning, is that kind of the crazy thing is that we have about 50% of Butte County residents who are unvaccinated. So you would expect if COVID was hitting everybody the same, that you'd have about 50% of your patients in the ICU unvaccinated also. But it's a significantly higher number. I mean, it's 92% of everybody in the ICU.
We often hear that I already had COVID, so I'm already immune. Is that true, or what's the logic behind that?
Well, that's a real timely question because some research was just published about this, and it showed that yes, indeed, for about 10 months after a COVID infection that a person has, their immune levels are good, and they can consider themselves protected. But they do decrease about 7% every month, and so by the time you're 10 months out, you're at risk for a reinfection, and who knows which variant we're going to have in 10 months. People who were sick in January were most likely infected by the Alpha variant, and people who are getting sick now are almost exclusively getting sick from the Delta variant. So who knows what's going to be out there in 10 months.
So if I'm understanding right, it sounds like for individuals who got sick in January or December, they're approaching that 10-month time frame where they would consider getting vaccinated in order to reduce reinfection. Is that right?
You're exactly right with that, because you can't count on the immunity lasting forever, and this would be the time to get vaccinated to protect against the variants that we have now and the variants that we'll be having in the future.
That brings us into my next question, that is, in addition to being in the middle of the pandemic, we're also approaching flu season. What are the recommendations around that?
Please, please, please get your flu shot. We were told during the winter of 2020 that we could expect a pretty bad flu season this year because there really wasn't much flu last year. Everybody had their masks on. We couldn't spread flu from person to person. We're expecting a lot more influenza this year. People have been going without masks because that's been the recommendations for some of us, and we expect that flu's going to be spreading. So yes, please get your flu shot, and it's important to know that you can actually get your flu shot and your COVID shot at the same time.
That was my next question. Was there any distance? But you answered it. That's great. So anything else you'd like to add before we close up for today?
Please get a vaccine and wear your mask.
Absolutely. And if you're looking to get your vaccine, you can go to the California My Turn, and you can look up where a clinic is closest to you to take care of that. Thank you. And thank you all again for watching. We all need good information to make decisions for our families, so thank you for doing your part to understand what's going on. We hope you'll consider vaccination if you haven't already, both for yourselves and those around you. Until next time, join us for our next Facebook discussion. Take care.